Hi, Mike Gibson and Charlie Chambers coming to you live from SCAI 2015 here in San Diego. Charlie, let's talk about, the occupational hazards of being an interventional cardiologist. I know I wake up in the morning and the first thing I do is rub my hands together because I can't feel, parts of my hands, and it takes a little time. After wearing all those years of lead, you guys just completed a survey to kind of put the numbers on all this, a SCAI survey. Tell us about the results. I did tweet about it. They're kind of astonishing.
Yes.
The incidence and prevalence of orthopedic injuries.
Yeah, you go into interventional cardiology for the patients. You want to make people better, but you realize with the X-ray exposure, you need to wear lead, and that protective, both ourselves as physicians and our staff, over time has to take its tolls. And the average interventional career, 30 years. Right. And imagine the staff who every day wear it. Right. It's certainly a problem. In 2004, SCAI put out a survey through the multi-specialty occupational health group. And looked at the incidents and the concerns that were raised, and it was concerning. We started looking towards issues that could be corrected.
In an era where we had the really heavy lead, real men with real lead, and now we've moved to the light lead, and so you've now updated it 10 years later. Have the results changed?
Well, that was a disappointment, I think, in this, is if you look at our advancements in patient safety with radiation, we're cutting down patient dose 70%. Yes. We've made huge advances.
And what are some of the ways we do that now?
A lot of it is the equipment manufacturers have made a real effort. Another is we appreciate the importance of education. I also tell people you wouldn't want someone flying your helicopter without, these new machines are helicopters. They're very complicated. You need to know how to use them, and you need to know the techniques. Right. And obviously physicians have been very receptive to these.
I know we have every year we have to attend training and get updated and certified every year to operate this helicopter.
And I would argue it helps. These are important things to do. And so we've come a long way appropriately for the patients. But the operators, we've not seen that. Our recent survey of SCAI members, at least 50% had some sort of orthopedic issue.
That was the number that I found astonishing. And when you look at it on an age-adjusted basis, that's including all the young guys. What if you look at old guys like us? Is that number even higher?
Speak for yourself.
But the problem with doing that, though, is the guys who have bad spine disease or cervical spine injuries are out. So it's the harvest effect of the people the only ones left cathing are the people who don't have the orthopedic injuries.
Excellent point. And I think that has to be emphasized. The people that aren't currently having issues, that had issues are out. They're out. Yes, that's right. That's a very good point.
So what are some of the most common orthopedic injuries?
Well, there's both the orthopedic and the other concern for oncologic.
Oh, sure.
I think the oncologic issues are a little more they're they're incidental reports that we don't know, but the left side of the brain, which you talked about, real concern. And those we're hoping to quantitate better. The National Institute of Cancer is trying to put together a report to look at this over years for physicians.
What is the numbers? Is it a 7-fold increase in left-sided tumors compared with the right, where your head is next to the ii there.
And when you have that, it's hard to say it's anecdotal.
Correct.
Isn't it? Yeah, that's a concern here. Right. Yeah. And orthopedic issues, there's Jeff Hartzler, the shame there.
Sure.
Dr. Hartzler, tremendous interventionist. That's significant. Right. Cervical spine disease. Yes. And myself, I've had my hip replaced. You'd be surprised asking people what they've had done. Right. Backs are common. And obviously the same with the staff. And it should not be looked at as a prerequisite to being in the lab. Right. It should be appreciated that you shouldn't have to jeopardize your life to do this.
But not only that, but also cataracts from the radiation. And we also stand in blood that has Hep C, Hep B, AIDS all day with sharps. So, if you said to someone, look, here's an opportunity, you can come in the middle of the night, stand in that kind of blood, get orthopedic injuries, get radiated, from an occupational safety perspective, it's a challenging, daunting field. So what's SCAI doing? What are we doing in terms of education? What tips do we have to help people avoid some of these injuries?
No, excellent point. And I think that's interesting. Who would think that you'd have a specific cataract? Right. And now we're realizing the importance of specific glasses. Right. And not just glasses.
Right, the side. That's where the radiation was coming in.
And feel it the same way they're concerned about it. So I think...
Which just kind of drives you a little crazy, because, you just want your peripheral vision, and you've got this thing there.
It's tough, I think what's nice is having worn lead glasses early in my career and getting away from them because of those issues.
Right.
Now they're lighter,
better,
and they fit better, and the side panels are much more effective.
We're getting some caps now that have lead in them.
Yeah, I mean, those are interesting issues. If you're going to have a higher incidence of left-sided, again, we don't know the results of that. We know the radiation exposure is less if you wear the cap. What consequence of that is going to be hard to show, but it would make sense if it was related to radiation.
Of course, we have lighter lead now. I think I find, what about the height of the viewing the panel, the TV and everything? I think if it's too high, a lot of people say, bending your head this way all day is bad. Other people say, well, if you're looking down all day, that's bad. I mean, do you have a preference in terms of the height of all the monitors?
I think those are excellent issues. I think if you realize you're at risk, then what you have to do is limit that risk.
Right.
And though table height can be important for radiation exposure, you have to get a table height that's good for you for the long run.
Right.
Though monitors it's an individual variation. You need to have there. Appreciating that when you step on fluoro, you only want to be on fluoro when you're looking at the monitors. You don't want to waste fluoro. But you want to be sure that that's at a height for you.
Right.
Back, a lot of, they have all these physical therapy for back and things. Be proactive if there's issues. Take care of yourself. And what's out there manufacturing, robotic systems, being out of the room is I think, benefit. Some of the zero gravity, these things suspended from the ceiling,
absolutely.
Options. But again, you want to also protect the staff. And some of those aren't options for the staff. So what SCAI is very interested in is, as we've expanded to the cardiovascular, but even before we expand, but now as the members are active, is to making sure the entire team understands the risks and is properly protected.
I agree. Charlie, thanks for stopping by and talking about this important topic. I appreciate it.
Thank you. Thank you for having. This is a very important topic. Thank you very much.
Thanks a lot, Charlie. And thanks to all of you out there for joining us here from SCAI 2015.